This morning, we welcome Dr. Erica from St. Vincent Healthcare via FaceTime. And Dr. Erica, I'm excited to talk to you, always am, but especially today because you just recently got your COVID-19 vaccine. So tell us about your experience and what that was like.
Oh, I was so grateful to be able to get it. It was exciting. I got it on Tuesday, and I think we have a video reel that we'll be playing. I was videoed as I did it, but it was just so exciting and it was emotional. I mean, it was bittersweet. Just so thankful to get the first step of the vaccine. No hesitations at all on my part, and just seeing all my colleagues down there, all of us who have been working so hard and seeing patients with this horrible disease get our vaccine was just a turning point, I think, mentally for all of us. And this was Tuesday. Today's Thursday. I felt fine
Good.
since
And I
I went to
see,
work yesterday. I didn't feel
yeah.
any different than when I got a flu shot, or, just my arm a little sore where they gave me the shot. And I really have no other symptoms from this vaccine, this first step of the two-shot vaccine of Pfizer.
Yeah, and you were even so confident. You took a selfie we saw there
I did.
during while
My
getting the
parents wanted to
vaccine.
see the selfie, so yeah,
Yeah, very
there was a
cool.
lot going on.
Well, thank you
Yeah,
for sharing
so.
that experience. And, some common questions or concerns people have is, this is developed all so quickly. So is this something that we can trust?
Absolutely. I trust it. It was developed quickly, but with a lot of work. It was developed very efficiently. It really went through all of the same safety measures. I was reading, close to 5,000 steps that all vaccines have to go through in these safety measures. It went through all of those same ones that vaccines have done since the 80s. It just went through it faster. And, we're currently under, as you mentioned earlier, for the Moderna that's getting checked today by the FDA, an emergency use authorization process for that.
All right, and as far as women go, there's some precautions that pregnant women or maybe women who are planning on pregnant should take. But as far as the COVID-19 vaccine, what do we know in relation to pregnancy? Can it cause miscarriages or anything like that?
So I've seen a lot of this on social media, people concerned that this should not be given to people who are pregnant or who are thinking of getting pregnant. There's a lot of misinformation out there about it affecting the placenta potentially, or causing miscarriage or causing people to be infertile. And really, if I won't go into all of the science on it right here, but looking back on it, it is misinformation. And any of the arguments that these people have would happen with natural COVID infection, not just the vaccine. And we haven't seen that. Even though this has been a quick pandemic, it's only been a year, there were people who got pregnant even though they weren't supposed to on the vaccine trials. And there's been no evidence of negative effects or infertility from this vaccine. Talked to a colleague of mine recently who's pregnant, and I encourage her, to talk to her OB, as I would encourage everybody to do. But all of the data that I've seen and all of the people I've looked at say there's no data right now that it's dangerous and that would be more dangerous to get the COVID infection during pregnancy.
All right. Well, Dr. Erica, thank you so much for your time and input on some of those concerns. We appreciate it, and we look forward to seeing you next time. You have a Merry Christmas and a Happy New Year. All right. We'll be back after this break.